Hi, I'm Dr. Marla Shapiro. I'm a former president of the North American Menopause Society, and I sit on the board of trustees. And I'm delighted today to be here with Hollis Herman. Tell us what you do.
I'm a physical therapist that specializes in gynecological, urological, colorectal, sexual medicine, all different kinds of down there.
Down there. So if I'm a woman watching this and I'm thinking, well, what does that mean? Like, who would come and see you? Because often we think of physiotherapists, biased by our healthcare providers, who send us when we've broken something or have a sore back. But when it comes to women's health, as a woman who's out there, I may not make that link that there's something that can be offered to me.
Exactly. So many women who are postpartum are told, you're leaking, so what did you expect? That's not the norm, and it should never be the norm. And so having any kinds of urinary problems, bowel problems, sexual problems, should really think that that is not going to be okay, that you should be having a healthy, functioning, fluid life.
So what about perimenopause and menopause, where many women think, oh, this is just part of aging and I have to put up with this?
Yes, the idea is that you should just have more lube, take a glass of wine, and go on a vacation is really not an answer. Most patients would do that if they could and try and make it so that it's better. So to know that your hip pain is related to your pelvic floor pain, and that there are 4 muscles that go from the pelvic floor to your hip. There are many muscles that go to your abdomen, that go to your back, that even the broken foot that you had 4 months ago, and now you're having some pain with penetration or just in terms of any kind of sexual functioning, can be related. So go to a physical therapist who is specialized in this so that they can connect the dots.
So if I'm a perimenopausal or menopausal woman who's noting some leaking when it comes to urinating, I don't make it to the washroom on time, or what can you do?
Yes, a lot of times the inside muscles of the legs are connected up with the urethra and also with the bladder. So they tug on those and make you feel like you have to go to the bathroom. Everybody should be able to sit through a movie. Everybody should be able to go all night without having to get up in the middle of the night to go to the bathroom. And that these are things that are not common knowledge because nobody has talked to them. And
100%. Embarrassment is key. So if you're a woman who's watching this and thinking, you know what, this may be something I need to pursue, how do I, as a patient, as a consumer, as a woman out there in midlife, find you?
You can go to your GP, and many GPs are now finding that knowing about physical therapy and this aspect of physical therapy. You can also go to the AmericanPhysicalTherapy.org, APTA.org, and there is something called a PT locator. So you can put in your zip code and you can look under women's health and find somebody who has been trained to know how to connect the dots.
And for our Canadian friends?
For our Canadian friends, the same thing through DianeLee.ca. She has people who have taken her courses and know all about physical therapy and orthopedics, how your shoulder relates to your pelvic floor, how your foot relates to the pelvic floor.
So pelvic floor therapists, a phrase women should keep in mind and pursue if they feel that this is something that might help them. First is awareness, right?
In most cases, it's 4 to 6 visits that you can change somebody's life, that you can make it so that they can really feel the satisfaction that they want.
Thank you so much for being here and talking about this topic that nobody talks about.
It is my pleasure. I really want to spread the word.